This is a video on donning of personal protective equipment by healthcare workers caring for COVID-19 patients. Wearing PPE and maintaining proper hand hygiene is essential to prevent transmission of the virus to healthcare workers. Respiratory protection is carried out using a N95 respirator. Eye protection is done with goggles or a face shield. Body protection includes a waterproof apron, long-sleeved fluid-resistant gown with a hood, and boot covers. Hands are protected by wearing gloves. The PPE does not need to be sterile. In this video, Anju and Rashmi will take you through the steps to don a PPE. The PPE should be donned in a place where it is safe to be without PPE. The first step is engaging a trained observer who will supervise and assist the donning of PPE. Prior to donning, visually inspect the PPE for size and damage and also check if all items of the PPE are in place. The trained observer should also make sure that the person to don the PPE is adequately hydrated and has used the restroom. Hair should be tied back and all personal items should be removed. Perform hand hygiene prior to the start of donning PPE. Hand hygiene may be performed with either soap and water or an alcohol-based hand rub for at least 20 seconds. All steps of hand hygiene should be followed. Allow hands to dry. Now begin donning the protective clothing. First don a pair of clean gloves. Now sit comfortably in a chair and wear the boot covers. Pull it up completely, ensuring a snug fit. Next, put on the long-sleeved fluid-resistant gown. Zip it up completely. The gown should fit properly and allow unrestricted movement. Next, don the N95 respirator over the face. Cup the N95 respirator to hold it close to your face over the nose with the straps hanging low. First, pull the lower strap over your head below your ears till it rests on the nape of the neck. Then pull the upper strap over your head and let it rest above your ears. Now press the bridge of your nose in order to create a tight seal. Breathe in and out to check for any leaks from the mask, placing your cupped hands over your mask. Check if the N95 respirator moves in and out with every breath. This ensures a proper fit. Now put on the goggles or face shield. They should be compatible with the N95 respirator in order to ensure a proper fit. Now pull the hood over your head. Put on the disposable waterproof apron over the gown. Now wear the second pair of gloves over both hands and pull it over the cuff of the sleeves of the gown. The process of donning PPE is time-consuming and should be done deliberately in a calm and patient manner. Please remember that there is no rush in a pandemic.